Many of my patients come to me after experiencing situations where they knew they should have said no, but didn't. They often tell me it's easier for me to say no to strangers or people I don't know well, but it's so much harder when it's someone I care about, whether it's a partner, a close friend, or even family. This struggle isn't uncommon. This is why teaching the practice of assertive no can have a big impact on their future path. Research from the National Institute on Drug Abuse emphasizes that teens who practice assertive refusal skills, or no in peer pressure situations, are significantly less likely to engage in risky behaviors, including drug use, unprotected sex, and unhealthy relationship dynamics. Additionally, assertive therapy has been shown to reduce bullying behaviors among perpetrators and mitigate its impact on victims. These findings highlight that assertiveness training doesn't just help in the moment. It's a long-term protective factor, shaping teens into confident, self-assured adults. The ability to say no confidently and assertively isn't just about avoiding harm. It's about self-respect, boundary setting, and building a foundation for healthy relationships. Let's explore how we can help teens develop this crucial skill. Setting boundaries and confidently saying no is a fundamental skill for personal and professional success. Research shows that teens who learn to assert their boundaries early in life demonstrate higher self esteem, better decision making skills, and lower rates of peer victimization. Assertive refusal builds autonomy. Teaching teens to say no reinforces that they have a right to make choices about their body, their time, and energy. Teens equipped with this skill are more likely to avoid harmful situations. A 2022 study from the Journal of Youth and Adolescence found that teens who practice assertive communication are less likely to experience bullying, coercion, and manipulation. Neuroscience backs the importance of this skill. During adolescence, the brain's prefrontal cortex, which is responsible for emotional regulation and impulse control, is still developing. Teaching teens to pause, manage their emotions, and respond assertively supports better long-term decision-making and resilience. Many teens struggle with misconceptions about boundaries and consent. Here are a few myths. Myth number one: if I say no, I'll hurt my friends' feelings and they just won't like me anymore. Myth number two: saying no makes me seem mean or selfish. Myth number three: I have to explain myself every time I say no. These myths create pressure to agree, even when teens feel uncomfortable. However, a major finding in Dr. Cloud and Dr. Townsend's book, Boundaries, is that people who respect others' boundaries tend to have stronger, healthier relationships, while those who struggle with boundary setting often experience relational stress and burnout. Dr. Henry Cloud and Dr. John Townsend emphasize that teaching assertiveness is key to fostering emotional health, strong self-respect, and decision-making skills that impact future success. Key tools from their approach: emotional and self-regulation skills. Teaching teens to pause and assess situations before reacting helps them develop resilience in challenging moments. Scripts for saying no. Pre-prepared phrases like, I'm not comfortable with that, or I need to think about this before making a decision, empower teens in high-pressure situations. Body language and tone. Reinforcing assertiveness through strong posture, direct eye contact, and a calm, firm voice strengthens their message. We make learning about consent and boundaries engaging, relatable, and practical for teens. We do exercises such as scripts for saying no, where teens choose responses that sound most like them and have it right in their toolbox whenever they need it. Number two, body language and tone exercises. Teens learn about verbal and nonverbal cues. Number three, identifying personal boundaries. Teens clarify their limits of activities or behaviors they're just not comfortable with. Lastly, emotional triggers. Teens identify emotional triggers that may lead to them having some blurry boundaries sometimes. When teens master the skill of assertive refusal, they build autonomy and self-confidence in their relationships. They protect themselves from harmful situations by upholding their boundaries. They learn to communicate their needs effectively, fostering mutual respect in relationships. This skill prepares teens for a lifetime of healthy interactions, from personal relationships to professional environments. Empowered teens are more likely to thrive in the face of peer pressure and challenging social dynamics. Let's be honest, most of us adults still struggle with saying no. Whether it's at work, with family, or in relationships, setting boundaries takes practice. So, how can we equip our teens to start learning now? By teaching them these skills early, we give them years of practice before stepping into adulthood. It's not just about protecting them during their teen years, it's about setting them up for success in all aspects of life. So, what could this skill mean for your teen?